I'm Mike from Bestoutcome. I've got a talk here that's talking about PMOs, and I'm going to illustrate that with three clients that I've been working with for the last year and a half in the NHS, and just really talk about how they have chosen to establish PMOs and how they're using those PMOs to underpin the work that they're doing. And I'm going to use three types of examples: a strategy, a strategic approach, a clinical commissioning group approach, and an acute trust as well. So, but just try and contrast that, and try and look at the benefits that they're getting from taking a PMO approach, and what they're looking ahead to in the future. In this presentation, obviously, I need to kind of generalise and in a sense, simplify. But what I was trying to do with this diagram was say the NHS, as we know, is under a lot of strain, under a lot of challenges. And I think the principal challenge that it has is to modernise and improve the services that it's delivering to patients, but at the same time continue to delivering those services. So there's that tension that we see in most organisations actually, but particularly in the NHS, to say we've got to keep doing the day job, but we have to change the day job because we have to. It has to improve. And so that was really what this was saying, that when the experience that I've had talking to the people on the front line as well as the people in the PMOs, they're saying there is this continual not only drive to change and improve, but actually the tension to say how can we actually change while we continue doing our day job, and that's a major challenge. I think my view is that is heightened in the NHS because there is so much scrutiny on what a trust or a CCG or a local authority is doing. So much scrutiny from the government, from NHS England, from Monitor, from the Clinical Quality Group, etc. So there's, I think, again for me, a heightened need to be able to demonstrate that the change that the organisation is going through is under control, that it is going to move to a point where the necessary outcomes are being delivered, that we should continue making this change, that we should continue on this path, for example, and one of the examples I'll give is about closures of some acute units, and to be able to visibly demonstrate and continue to demonstrate that progress is proceeding and is on track. And why are PMOs relevant to this? I think they're relevant to this in that in order to be able to provide that assurance, in order to be able to provide that visibility, in order to be able to report as necessary to the governors and the auditors, then we need to have a collection of information that can be served up to those people. So, and that's typically what a PMO is able to do, to act as an information hub, to know all the initiatives that are either going on at the moment or are planned for the next year or the next 5 years, and to have this ideal of a single version of the truth, so that you can go to a central point and find out what benefits are we expecting to deliver in the next quarter, or what savings are we expected to deliver, how are we doing against achieving those savings. So a PMO, an information hub, a central version of the truth. PMO. So can I just ask, how many of you have PMOs, work in PMOs at the moment? Okay. And the PMO, does P stand for project? No? Or portfolio or program? It's kind of a movable feast, isn't it? All three. Excellent. Okay. So, and I think that in itself is interesting, because you think about when I'm talking about a project and a project office, what's the difference between that and a portfolio? And I'm sure you don't feel this, but there are stakeholders who do feel this, that PMO talks about, it's just an administrative operation, it's just about chasing people, it's just about organising meetings. That is so wrong and so unfair, I mean, my own view, having worked as a program manager and project manager and consultant, is I think that PMO is one of the most exciting places you can work in any organisation. You're right at the centre. You can see everything that's going on. You should be able to see everything that's going on. You can be insightful. You can help people make decisions. I think it's a really, really exciting place to be. So when people say PMO is boring, administrative, I don't believe that's true, and it should not be true in modern organisations. Portfolio, what's the difference between portfolio and project? Well, for me, I think, portfolio or programme is you can see more than one project. Yeah, you're helping and serving up a vast array of projects, and I'm using the word project quite loosely. I mean initiative, and whatever you choose to call them. But with the ability to look across multiple projects, there is the ability to provide governance assurance. And governance, again, it's a big word. What does that mean? Scrutiny points, overview boards, review bodies, etc. So the PMO can provide assistance to that and assurance and help with good ways of doing things, but best practice. Help with planning assistance, risk management guidance, and pointing out things that might potentially trip us up in the future, or opportunities to realise. So I think Portfolio Office is exciting and where it's at. And can I ask how many of you are P30 accredited? Yeah. If any of you have not looked at that, I'd encourage you to look at that. I think it's a great body of knowledge and a really useful thing to study and start to using. I think it's a really and I think the emergence of P30 and Sue Vowler's work in that is helping to just make the portfolio, the PMO, a much more attractive place to work, and a much more, in a sense, a more structured place to work. That's good. I would recommend that to people. So the 3 case studies I'm going to talk about are one at a strategic level, so looking at a 10-year plan for a collection of clinical commissioning groups in London. Then I'm going to look at one of those and how they are taking that strategic view and actually working on the ground to do that. Then I'm going to look at a hospital, an acute trust, and talk about how they are, what work they're doing and how the PMO is helping them underpin that. And I should also mention that everything I'm talking about here is in an article that is in this magazine this month, so in the October magazine, Project Manager Today. So all of the information I'm referring to is in there. So the first one is the North West London CCG collaboration. That was a hard title to fix on the organisation. So in Greater London there are 32 clinical commissioning groups, and the ones in North West London decided to join together when the CCGs were formed in 2013. They decided to join together to collectively set some strategy and direction centrally that could then be implemented locally in those CCGs. And the ones that got together were these, to look at the opportunities to improve the services that were being delivered in those CCG areas, and also to look at 7-day services. So this is one of the areas where 7-day services is being, I say piloted, that's unfair, is being trialled. And they are using a, I don't know, what do you call it, a slogan, I suppose, of shaping a healthier future as a banner. And they decided that in terms of looking at the opportunities and looking at the cost savings and looking at whether there should be closures as well as there should be improvements in the services and extensions in terms of the staffing, etc. They were going to set that 10-year strategy locally, from a centre, and then offer that down to the CCGs to implement locally. And they identified 4 key strategic long-term pieces of work, and all this information you can find on their website. So 4 programs of work to reconfigure hospitals in terms of the units that are there, and including centralising units across northwest London. The whole systems integrated care programme, which is looking at a patient-centred care. The primary care transformation, which is one of the highlights of that, is looking to 7-day-a-week service, and self-management, so allowing people to take greater control of their own health needs. And as you might expect, and in a new organisation, they did not immediately have processes to follow. They didn't immediately have tools to use, but they started using the tools that were available, which was naturally Microsoft Office and Excel. And they rapidly got to a point, and some of you may have found this as well, where Excel is fantastic and incredibly flexible and incredibly manually intensive and incredibly prone to error because it is so flexible, where they needed to eliminate room for error in terms of the reporting. And so what did they choose to do? What you might expect, to establish a PMO. I'm trying to think whether they name it as a program. I think they call it the Program Management Office, yeah. And they said, what do we need to do on a regular basis in order to satisfy that need for visibility of governance and openness? We need to work out a cycle of processes that can be followed by each and every one of those programs, so governance processes. And they decided to set up a 2-weekly reporting cycle, so where every program and every piece of work in the program would come back on a 2-weekly basis and say, according to our plan, this is where we are, according to the key indicators. They decided to move away from Excel and to use a cloud-based portfolio project management tool, ours, as the opportunity to standardize, to centralize, to control. And as a PMO, they were also able to support the implementation of these strategies locally across the CCGs. And through the process and the embedding of the process, and then the support of that process by the tool, they are now able to have concise, accurate progress and status information of the work that is ongoing across those projects. So let's look at one of those clinical commissioning groups, and I've just chosen Hillingdon because I have this information about it. There are 3 districts and a number of units that are served by the CCG, by the Clinical Commissioning Group, and they're implementing those programs that I illustrated from the centre. I'm just going to look at one called Shaping a Healthier Future. So again, here's the website of Hillingdon CCG, and that explains that the GPs there that run the CCG have this vision for their community to create this environment for their residents. And they identified 3 pieces of work to take the overall strategy and implement that. So the reconfiguration of hospital services under the Shaping a Healthier Future banner, the out-of-hospital strategy, so that's looking at care provided outside of the hospital, so in the GP practices and in the local community. And really importantly, to look at the finances that underpin this in terms of recovering their position and achieving savings. And I think this is one of the things that struck me here, perhaps more than anywhere else, was the absolute focus on savings and the need to guarantee that those savings are going to be achieved, or if they're not going to be achieved, then identify remedial work to actually address that. How many of you are familiar with QIP programs? So an initiative that I think I'm right in saying started about mid 2005, 2006 as an initiative, and is now in phase 2, which is looking at a number of indicators about the services that are being provided and the measures and the quality of those services, and the cost of those services. So, and the savings that need to be achieved. So, why am I saying that? Because, again, Hillingdon decided that they needed a central hub of information and a central process area to underpin all of this work, which of course is big. They're big and complex pieces of work and multi-year. So again, what did they do? They looked at the processes, and I think that's it might be strange. My company, we promote and sell tools, but I don't think the tool's the important thing. I think it's the process that's the important thing, and the tool should always then support the process. So, and that's why I illustrated for London. They looked at process first and then looked at tools, and again, Hillingdon did the same. They looked at what governance processes are appropriate, and then let's find some tools to support them. They also chose a 2-weekly reporting cycle, which is quite interesting that they have, and I'm trying to remember how many projects, 70, 80, 90 projects ongoing at once, actually in train. And half of those report this week, and half of them report next week, but each of them works in a 2-weekly cycle, which is a way of managing it. And that feeds the governance bodies as well, because they don't get overloaded or overwhelmed with information. Again, I'm sure some of you have seen this. Recently there was a challenge sent down to CCGs to become paperless by 2020, I think. And one of the things I've seen here, particularly in Hillingdon, is that rather than take just reports into meetings and sit there and look at reports, they take the PPM tool in and they interactively look at the information and drill through it in the meeting. So luckily they've got a big screen and a projector, they can do that. But the meetings I've been in with them, that proves to be very, very effective and efficient way of doing things. Again, the PMO is able to underpin and assure visibility and consistency. And I think consistency is important here as well, because they have decided, or they've been told, the indicators that they need to look at, so clinical quality, cost of savings, and progress, etc. And all of the pieces of work are asked to report 2-weekly against those criteria. So that gives a consistency in terms of the reports that come out, and allows them, as you might expect, to early identify pieces of work that, in their case, are possibly not going to achieve their savings targets, and then decide what to do to intervene, if necessary, in those. And the third example I've got, again of a PMO, is at Rotherham, NHS Foundation Trust, based at Rotherham Hospital. And I hadn't realised that when I started working with them, that they were one of the first trusts in England to achieve Foundation Trust status. They serve, I mean, compared to London, it's not as big, but they still serve a fairly sizable population. And they are under obligation to achieve savings targets, and they have a savings target of more than 10 million for 2015-16, at the same time as needing to spend money in order to develop the new services. And there's the tension already to say, we can't we are unlikely to be able to achieve savings unless we invest in order to have more efficient and more effective areas. So, and the biggest example there is the emergency care centre, where they're reshaping and remodelling their A&E to be an emergency care centre. So the sorts of profiles they're looking for is our cost spend and our savings targets as they come up the other side. Again, there's the trust site there. And earlier this year, the Chief Finance Officer was looking at the way all these pieces of work were being governed and looking at opportunities to help the people who had to make decisions about shall we continue with this work or shall we reshape it, to be able to make more consistent, more informed decisions, because the management committee said that they were finding it difficult to be sure that the information they were receiving was good and accurate and consistent and ran through the various reporting periods, for many reasons. So his decision was to establish, again, a PMO, a Programme Management Office, to look at the processes for the collection of information from all these initiatives and from the various stakeholders, and then to use, again, a centralised, standardised tool to report against those processes, and to look at people and to not simply say, this is the process, this is the tool, get on with it, but actually to provide instruction and encouragement in the processes and the tool. And I think, for me, importantly, the recognition that we will always have the opportunity to improve our processes and the way we use our tool. So to foster a sense of improvement and continuous improvement. So I tried to just look across those, the PMOs serving different stakeholder groups, but essentially doing the same role in terms of helping people understand the process, follow the process, then use the tool to support that, and then distill the information out of it. And what they all said was, it's important to understand who the stakeholders are, and I know, we've heard that probably in every talk, and of course it's absolutely true. But who are the customers of the PMO, and who are the providers of information into the PMO? And encourage the people who provide the data, and I'll say project managers or workstream leaders or stakeholders, to own that data, to maintain it themselves. And they, without hesitation, they all said, let's get the basics in place first. Let's get, just quickly and simply, get a register of all the initiatives that we need to keep track of. And sometimes that's really hard to do, isn't it? Just find out what's moving, and depending who you talk to, you get a different list. So get that list together, and get some dates in place, get some red, amber, green statuses in place to start with. Just get the basics in there. Of course, talk about resourcing, of course, talk about benefits, of course, talk about schedules, but we need the basics in place first. And it's not always easy to just get those basics there. And also quickly establish a drumbeat of regular reporting. And I've said, so the North West London and Hillingdon are on a 2-weekly cycle, and Rotherham are on a weekly cycle of reporting. Why is that important? I think it's important because if you're being asked to sit down every week or every 2 weeks and provide some information about what you're responsible for, you're only going to do that, you're only going to continue to do that if people come and ask you about it, if you know that people are using that information. If if you report and nobody's using it, well, why bother? So establishing this drumbeat they found very useful because it guaranteed that the data that was being provided was being served up and was being used by the customers. And it allowed them to have discussions about, is this the right information? Is it telling me what I need to do? And I think I've probably said this already, but again, all of the PMOs as they were setting it up said, be holistic. Firstly, it's about people, about encouraging people to provide data, to provide accurate data, to provide regular data, to use the data, to question it. It's about people, and then it's about process, and then it's about tool. But treat them all together. And having gone through those types of exercises, it itself is a process in establishing high-performing, value-added PMOs. What are the sorts of things they're looking ahead to? So the annual planning rounds of actually looking about, and the next year's expected pieces of work. How should we forecast that? How should we forecast what we have to spend against the savings that we're going to make? So the PMO's very well positioned to do that, very well positioned to help once those pieces of work are approved and are launched, to actually help planning those and giving consistent and structured ways of chunking up those pieces of work and planning them. They're also talking about gateway meetings, so in a sense to formalise go, no go processes. So go, no go for funding approval, go, no go for benefits realisation, and particularly go, no go for when a new service is becoming live, to actually make sure that we are ready to put it live. To do knowledge management and process improvement, and to take the opportunity, again, particularly at those gateway meetings, to say, okay, for this project, are we ready to go? But let's also look backwards and say, as we got to this point and we followed the recommended ways of working, can we learn anything from that? Can we do anything that would make it slicker, smoother, better next time round? And to naturally focus on benefits realisation and savings reviews. And I just wanted to illustrate that here. So, for example, I said that Rotherham are building an emergency care centre. I just wanted to try and illustrate what for me is the difference between what a project hands over and what the organisation wants. So, if we say that the project output from the emergency care centre is a brand new emergency care centre, you would say, great, so what? Well, because the day it opens, you haven't realised your benefits, you haven't got your outcomes, have you? You've just got that new facility there, which offers up a capability to provide an enhanced and improved service for the people who are going to use it. And as that capability becomes condensed and consolidated, then we will be able to achieve the outcomes that we are after in terms of patient care and quality of care. And that in itself should lead to benefits or savings. I think there's an interesting and very powerful chain there. And just in summary, what the PMOs have helped empower for these organisations is the ability to say, we know the portfolio of work that this organisation is running, and we believe that it is the right portfolio with the right prioritisation. And there are plans in place and there are schedules in place according to the standards, and we have decided we have advised people on an appropriate level of governance in order to satisfy central operations and the auditors, as well as the internal stakeholders. And because we have the portfolio we need, the plans we need, and the governance to oversee the delivery of those pieces of work, and if necessary, challenge them and reshape them, then we can be assured that we are moving towards achieving the right outcomes. Thank you very much. I'd be happy to take any questions.
So that was sort of leading towards me asking two things. One is, how much of an investment decision was it for them to take the PMO function to the level that you've talked about, and was that very hard to get them to see the benefits of that? And then secondly, do you see them talking to other parts of the NHS and saying, yeah, look, we've benefited from this. Have you done the same thing? I just wonder how the NHS might be helping itself.
Yeah, good questions, thank you. In terms of justifying the PMO, I'll reflect back on those three examples. Certainly the PMO in the centre is of the order of 7 to 10 people and has been in place since 2013. So there is a commitment to fund that, and they're finding the benefits. In Hillingdon, it's 3 people. In Rotherham, it's 3 people. So not necessarily big, but there is a commitment to establish it and continue to fund it. One of the things you'll see if you look at, I'll come to you in a sec. Yeah, one of the things you'll see if you look at P30 is it helps you build a business case for having a PMO. Now, to my knowledge, those 3 have not been through that, but it's a fair question. So, sorry? And it's so when I say PMO, I mean the process environment. So I think in all of those 3 cases, the Chief Operating Officer and the Chief Finance Officer have made a personal commitment to do this and are justifying it. In terms of do they talk to each other, my own view is they don't talk to each other as much as I wish they did, but I kind of understand that because they are so busy that finding the time, I mean, like ourselves, you know, I'm sure all of us to take a day out of our work has been quite an ask already. So they're faced with that. Though certainly in South Yorkshire, there is now a group of trusts and organisations that are getting together. They've had a couple of meetings now to share information in the PMO space. So that feels good and encouraging to me. But yeah, thank you. So you had a question, yeah?
Hi, I'm not sure of exactly all the details, but I know that CCGs do national reporting either to local authorities or to organisations like the Care Quality Commission.
Yeah, and to NHS
I'm just
England.
wondering if, as part of like the installation of these PMOs and these organisations and the reporting that they do, do they feed that reporting into those, you know, higher, wider national reporting?
Yes, our guarded yes. So, as I was trying to say, one of the initial pieces of work that each of those PMOs did was they decided who their customers were. So who did they have to report to? And I think, to be honest, they probably focused a little more locally to start with in terms of their governing bodies and their auditors. But certainly in northwest London, they are very conscious of NHS England and monitor and are looking to feed them with those reports, with that information. And there are some standards and key indicators that the CCGs have to report against. So yeah, they're building that in. Yeah. Yes.
Hi, thanks. It struck me the weekly and 2-weekly reporting cycle was quite short. And what's your view on the balance between reporting and managing the business? You talked about people being under pressure there through just being busy.
Yes.
Have they got any time to actually look at corrective actions and manage it, change things? Or is it strikes me it's very much about reporting.
It's an interesting question. The drivers that I saw in these examples, and they're probably, you know, is what I'm talking about, was from management teams who were finding it difficult to be accountable to their managers because they were uncertain of really the quality and consistency and goodness of the information that they're having available. So I think that drove that particular cycle to say we want to improve the quality of the information that we have available to be able to serve up to our masters. So that was certainly the focus of the PMO and the focus of the project managers, with wanting to not overburden the people who are delivering these complex programs with too much administration. Has it helped them in terms of being able to get on with delivery against bureaucracy? I think to a certain extent it has, yeah. But particularly having a single standard against which they report week in, week out, and all of the pieces of work are tracking against the same indicators, that has helped. Have they got enough resources to do the pieces of work that they need to do? That's hard. And I think the pressures on the management of these organisations to hit the government targets are sometimes just, I can't imagine what it's like on some of those pressures, because you're being asked what I think are probably extremely ambitious, sometimes unreasonable demands. So competing stakeholders is I think a major challenge. Not sure if that answered your question, but it's real tensions, yeah. Sure. Yeah, okay, on time.
I'd just like to agree actually with the previous speaker and say I thought exactly the same thing, and you must be having project managers spending at least a day a week producing data, I would say, and it sounds, as I think you suggest, symptom of a broader issue, probably. I wanted to ask you a more general question based on your experience, was what do you think are the key factors for moving from the sort of project support office, shall we say, that you showed earlier in your presentation, the admin and chasing, to moving to the sort of, the more governance focused, what do you think are the key things to actually move from one of those types of PMOs to a PMO that adds more value in that way?
Yes, good question. Let me first answer your first question, which was about the amount of time taken. And for our tool and for our processes, it's about less than 5 minutes a week for a project manager to fill in the basic information. So, and that's kind of as we designed our tool, because it should not be overbearing. But on your bigger question, how to move from the perceived administrative situation to a more value add, I think three things. Again, just think about who cares, who are we meant to be serving, who wants information, what information do they want. Let's make that consistent. So for me, it's the consistency and regularity of that information which will service the consumers. So the PMOs are then perceived as adding value because they are guaranteeing that the information is useful, consistent, complete, and up to date. And in terms of feeding the governance bodies, they have also, I've seen these looking at scrutiny points. So, for example, the quality, the QIAs that they need to do to actually standardise the sets of questions that are asked at particular points in the life of a project. And again, as a PMO, facilitate people in answering those questions and consistently, and then being able to be seen to be adding value into the process and not tying it down with bureaucracy. A couple of things, really. Okay. Would that agree with your...
I think I would agree, although clearly I think you might also need to recruit some more senior people in, depending on what sort of project management office you started with.
Okay.
And in
Sure.
terms of what you're looking at, you would be looking at recruiting somebody rather more senior than if, your project management office is mainly used to chasing round and chasing up actions for project managers. But I'm sure that you're making that assumption.
That's a very good point, thank you. Yes, in all of those examples, the CEO, the Chief Operating Officer or the Chief Finance Officer appointed a person in charge of transformational change who then took control. So thank you, yes.
Thank you.
Yes. Thank you very much.